Hello and welcome to my presentation on dissemination of CAUTI reduction interventions evidence-based practice project. My name is Terry Tapia and this is for Nursing 590 evidence-based practice project for Grand Canyon University. The purpose of this presentation is to discuss the research found during the evidence-based practice project to reduce and manage catheter-associated urinary tract infections, or CAUTIs, within facility practice using the following question: how to reduce occurrence of catheter-associated urinary tract infections, or CAUTIs, in elderly and medically fragile patients within facility practice. So by developing practices from a PICOT framework, we can develop care plans based on best evidence-based practice for our patients. There is no universally accepted evidence-based tool to reduce CAUTIs like there are for other healthcare-associated infections, according to the American Nurses Association. Therefore, formulating a plan to help improve care and reduce the risk of and development of CAUTIs through use of a PICOT question is central to educate, improve knowledge, and empower clinical staff. Implementation of new interventions based on proven evidence-based practice can create positive change and reduce the rate of infection in elderly and medically fragile patients. So what is a CAUTI? A CAUTI is a urinary tract infection associated with the use of an indwelling catheter. Among patients diagnosed with UTIs acquired in a care facility, approximately 75% are associated with a urinary catheter. According to the CDC, 15 to 25% of hospitalized patients receive urinary catheters during their stay. In the United States, there are approximately 50,000 residents in long-term care facilities with indwelling catheters at any given time. Given the number of patients in acute care and long-term care facilities, the risk of patients with catheters is a very large number. Although morbidity and mortality from CAUTI is relatively low compared to other healthcare-associated infections, the high prevalence of urinary catheter use leads to a large cumulative burden of infections with resulting infectious complications and deaths. And that's according to the CDC. An organization's success at implementing new policies and procedures depends largely on its stakeholders' readiness for change. Who are the stakeholders? It is our leadership team, it is our clinical staff, it is you. Organizational readiness requires a multi-level, multifaceted plan associated with staffing, leadership, and quality of care. Organizational culture affects all aspects of our business, from punctuality and tone to overall patient care. When workplace culture aligns with our own beliefs, it is more likely to support a change initiative that affects daily activities. So what is organizational culture and readiness? Organizational culture is the collection of values, expectations, and practices that guide and inform the actions of all team members. And that's according to TriNet. So using our problem statement, in elderly and medically fragile patients, would nurse-led interventions based on standing orders implemented by nursing staff based on evidence-based practice and new procedure criteria decrease the occurrence of CAUTIs reported in the facility over a 12-week period in comparison to no change in current methods used? Indwelling catheter misuse places the elderly and medically frail patient at greatest risk for developing a CAUTI. Medical frailty is theoretically defined as a state of increased vulnerability with decreased physical reserves and a loss of function in multiple body systems. And that's according to Rizé Chassavrou. When planning interventions, it is important for staff to understand why it was imperative to review the current protocols, adjust them, and then implement change. UTIs are the 5th most common type of healthcare-associated infection, with an estimated 62,700 UTIs in acute care hospitals just in 2015. UTIs additionally account for more than 9.5% of all infections reported by acute care hospitals, and that's according to the CDC. Staff must recognize when a patient has an IC already in place and question whether there is a valid reason for it to stay in place or whether it should be discontinued. So, identified risk for and causes of CAUTIs. Errors in initial catheter insertion, lack of proper pericare, duration of catheterization, microbial colonization of the drainage bag, unsupported continued use of catheterization, diabetes, and being a female gender. ICs are medical devices utilized in both hospital and long-term care settings to relieve urinary retention and urinary incontinence. Of the almost 100 million catheters that are sold annually worldwide, 1/4 of them are sold in the United States. The most common urinary catheter in use is the fully indwelling urethral catheter. It is a closed sterile system that is comprised of a tube inserted through the urethra and held in place by an inflatable balloon to allow urinary drainage of the bladder. ICs were originally designed to be used only for a short period of time in patients. However, over the years, the use of an IC long-term is now more common. This project will be incorporating new charting and procedural steps in the insertion, continued use, or discontinuation of an indwelling catheter in patients. The bundle is a collection of processes needed to effectively and safely care for patients and provide daily monitoring of the need for a catheter and help remind staff to remove the catheter as soon as possible. Research has shown that significant reduction was found in the incidence of a CAUTI, 60%, so from 10.7 to 4.5 per 1,000 catheter days with the intervention of a CAUTI bundle implementation. The key factors that contributed were significant reduction in device utilization ratio, so from 0.71 to 0.56, and average catheter days per patient went from 4.8 to 3.7. So the CAUTI bundle, it includes hand washing, avoid unnecessary urinary catheters, insert urinary catheters using aseptic technique, maintain urinary catheters based on recommended guidelines, and review urinary catheter necessity daily. So on this slide, we're going to discuss the pathogenesis of a CAUTI. So how does a CAUTI start? Urinary tract infections may begin as soon as a patient receives a catheter, upon insertion due to break in aseptic procedure, or days afterward due to lack of proper handling, lack of pericare, or from colonization of pathogens. Residual urine in the bladder of catheterized patients increases the risk of bacteriuria. During the process of infection, bacteria will begin to adhere to the epithelial cells of the urinary tract and or the surface of the catheter and then develop into biofilms on the catheter surface. These biofilms are resistant to the immune system and to antibiotics. During the research, a literature review process is needed. So on the slide, you'll see the different steps for literature review. It includes collecting articles, reading literature, summarizing the state of the research, identifying gaps, relations, variances, and suggest next steps. So in the analysis of the research completed for this project, the need for additional education regarding when to use an IC and when to consider alternative methods rather than using the IC. According to Katayama, UTIs are 5 times more likely when a patient has an IC resulting in a CAUTI. These CAUTIs can lead to significant complications including pyelonephritis, meningitis, sepsis, bacteremia, and death. Nationally, hospital-acquired UTI results in 13,000 patient deaths each year and increases healthcare costs by more than $400 million per year, with each UTI costing between $500 and $1,000. A key intervention is to reduce the misuse of ICs through education of clinical staff on the appropriateness of using an IC by instilling the catheter bundle program and providing a list of possible alternatives that could be used instead should assist staff in reducing the number of ICs in place, reduce the number of days an IC is inserted, and decrease the overall number of CAUTIs. Alternative products such as external catheters like condom catheters for males, PureWick suction devices for females may provide better options to caring for specific patients. Use of quantitative research allows for data collection through measuring the rates of CAUTIs prior to implementation of the EBP project and after the implementation. This research is appropriate for use due to the focus on verifying the project data. Questionnaires will be used to understand staff knowledge both prior to and post implementation and will be completed to measure the staff's knowledge on the topic. Use of current and post-intervention organizational statistics relating to rate of CAUTIs within the facility will be taken and compared. These methods are appropriate as they provide information needed to evaluate the effectiveness of the project. Our implementation plan, it has 5 steps. So research, data collection, planning, implementation, and evaluate. In considering the research at hand, a change model was used, the ADKAR model, which stands for awareness, desire, knowledge, ability, and reinforcement. So the delivery of the EBP project change interventions will require several steps to be successful. This need assessment will provide feedback regarding the current knowledge, skill, and readiness for change of the staff. Once staff, leadership team, and researchers agree with the need for change, change can then be planned. The first step is to be aware of the need. Understand the culture and readiness for change in order to understand the desire and current knowledge. Consider the ability of those who will need to enact the change intervention. Reinforce the new interventions and assess for success. In evaluating our plan, the one-way ANOVA test was used. ANOVA, which stands for Analysis of Variance, is a statistical test used to analyze differences. The one-way ANOVA test was selected for this project to help analyze the findings. This type of analysis can be used when there is a single independent variable, and the goal is to investigate if variations will have a measurable effect on the dependent variable. The main interest of analysis is focused on the differences of group means. However, ANOVA focuses on the difference in variances. That's according to Kim. The goal of the research project is to identify ways that CAUTIs can be reduced through activity and or new policy procedures assessed by staff in the facility. In summary, the proposed EBP project will use steps and resources named in this report to effectively introduce and implement change processes. By following a structured and organized change plan, staff should stay engaged and support the interventions, thus maintaining a positive environment to incite change within the facility. Efficient and thorough use of the resources, as well as creating buy-in from stakeholders and monitoring to ensure that new processes are being utilized, will be key to the successful completion of this change project. Thank you.